Today, we're going to continue our early morning series on what's happening of interest in modern science. And on everybody's mind is AI. Griffin is writing about MI on our behalf. But there are a lot of interesting articles coming out. I would say almost daily, if you look at any paper or any subject, 2 or 3 stories for each publication are on AI, either the kerfluffle over chat and the problems they've had, trying to analyze the impact on our society. And so the question we're addressing today is, what is the impact of AI in medicine? What is it likely to be? What are the pluses? What are the minuses? I would say from my perspective, and taking say a 50-year stance, it's the use of computation to handle large amounts of data and present it in ways that people understand. Is AI a qualitative change from what's come before? Well, it's certainly acceleration. It uses more data, but in some sense, it's not really a huge change from what we could do with Wikipedia, what we could do with computers before. So although AI has achieved a lot of attention, in my personal opinion, it's a natural extension of computational power applied to daily life problems. And that's also true in medicine for the most part. There are some things that are probably new in AI as applied to medicine, but most things are extensions of what's already been going on. Let's take it apart. And the first thing we'll talk about is the relationship between the patient and the doctor. When I was studying the transformation of NYU, one of the things that made it very clear was a totally transparent information system had transformed the efficiency, both in terms of patient care and the finances of the academic hospital system, from anything from patient care to the cost to research to teaching. Over the last 15 years, that one hospital, and then many other hospitals and other institutions, have instituted transparent information systems, whether that's the systems that they've set up with Epic or other similar organizations. They've worked with them. It allows a certain degree of transparency, in fact, a great degree of transparency. So from a doctor's and a hospital point of view, it's been an information system has been important. What's especially important about the NYU system that I wrote about is the fact that it is a unified system, that there is no interface between any input, whether it's a laboratory instrument, a doctor's instrument, a doctor's medical record, and the information system. Similarly, for all financial transactions, it's all housed in an easily transmissible system, and that allows tremendous flexibility for management. For example, it allows for every procedure you to know the fixed and the variable costs. How much is the variable cost of the medical procedure, and how much is the fixed overhead cost? And therefore, it allows experimentation. If the system is large enough, they can introduce changes to improve the efficiency or the outcome for the patient. And it's had a lot of impact. Procedures have been changed, how operating rooms operate, the kind of treatments that people get. They do something there that I think could be frightening, but is very important for organizational efficiency, which I call horizontal transparency. It means that one doctor doing a certain procedure can understand through the information system, and everything that doctors are doing has to be recorded. in this system can be related to other doctors doing the same thing. So they can see what patient satisfaction is, what the costs were, what the procedures were, what the side effects were, and they can make comparisons. And they actually make that available to the various doctors during various procedures, so they can see if there are more or less infections. And also management can see that. So it is tended to increase performance toward the best. So the delta in the performance, the difference between the high and low performers, has shrunk, and it's all moved up towards the best. It's one of the reasons that the NYU medical system is rated the #1 in the New York area, and in many years, #1 in the country, 1, 2, or 3. They've done the same thing with education. You not only take a test, you know, because the information system captures it, what you performed on every answer, what the average was on every answer, and you can improve yourself. And it's got tremendous potential for helping the education process. There are many, many changes we've gone through. So has AI changed that? Well, it will change it somewhat. One of the things I talked a lot about to the information people who are in charge of that, building that system, was the interaction between the patient and the doctor. As we all know, it often takes a lot of time for doctors to write up the interactions that they've had with their patients. It's not a straightforward process. And they were then just considering the new systems that can photograph or record, not just photograph, could take a film and capture the conversation between the doctor and the patient, reduce it to a chart. The doctor would then analyze that and present it to the patients. I can tell you that some of the systems that have been introduced, My Chart, for example, by Epic, has been really important for me personally, because what you can see is you can see what you saw with your doctor, what the doctor's notes were. You can actually read, you can look at the procedures and look at the results, both the diagnostic tests and the imaging results directly yourself. You can make those available to others. It's not so easy, but you can do it. And now there's ways to transfer that information from one health system to another. These are AIs that are really valuable. One of the things that people have looked at with AI and the patient-doctor interaction is how much of the information is not actually transmitted. And if there's a record that the patient or the doctor can go back and look at, we can understand what the doctors actually said to the patient. And the patient, if they don't understand, can try again and can ask some more questions. So that's just a very simple use of this kind of technology. Is it going to be invasive? Will the safeguards against patient privacy be eroded? That depends upon how careful people are with the HIPAA regulations. I can tell you personally that from what I can see in the records that they've taken, they're very careful. They're certainly cognizant of it. But we know with any information system, there's ways to hack it. There's ways to disturb it, get into it, understand, and to relate people's outcomes with their individual. And if your employer is doing that, if people with bad will are doing that, if people want to market things to you are doing that, that is a potential downside. So for everything that we humans do, there's ways to think about how to use it for good. And as we all know, there are ways to abuse it. Nobody's going to say that the computer revolution of today is free of fraud, is free of manipulation. I think we all are familiar with getting warning signs on our computer. Some are real, that say somebody's hacked into you. Others are spam, and we're getting more and more sophisticated. I would say at least once or twice a week, I've the target of spam attacks, sometimes very clever spam attacks disguised as emails, and we're all familiar with how to navigate that. That will only become more apparent with AI. Will that happen in medicine? Yes, it will happen in medicine. There are a lot of fake medicines that have always been around. In fact, there's a whole library at Harvard devoted to medical charlatans, a special library, which is very large. I used to actually teach Harvard students, medical students, about the kind of medicine that is not proven. It doesn't mean it's all wrong. It just means it's not proven through current methods that have been worked out for years to show what medicines are effective and what aren't. But there's a very large literature, long history, going back many, many centuries, in fact, millennium of fake cures for various things. And one of the things medicine tries to do better is to try to understand what is good and what's bad. But so those are some of the things that are happening between right now in hospitals.